with Anthony Acampora.
Welcome to the Faith and Recovery Radio Show. I'm your host, Anthony Acampora. I'm also the director and chaplain at Banyan Treatment Center's Faith and Recovery Program. The Faith and Recovery Program is a faith-based drug and alcohol treatment program. It's part of Banyan Treatment Center. It's in Pompano Beach, Florida. It's a non-denominational, Christ-centered program designed to allow clients to establish or restore their faith and relationship with God while addressing their addiction. So if they never had a relationship with God, they're going to establish one. If they had one, which happens often in active addiction, and they kind of fell away from that, they're going to restore that. If you have any questions or would like a free consultation or have anything to do with mental health disorders or addiction, 201-538-2754, 201-538-2754. You can call me directly, and we will do whatever we can to try to assist and help you or your loved one. At this time, I would like to introduce our guest. We have a very special guest on today. Incredible background, such a heart for helping people, and you could just kind of read about her and tell that. Dr. Lena Dobson earned her PhD in clinical psychology with the emphasis on neuropsychology assessment from Nova Southeastern University. While completing her PhD, she was the primary investigator for a 6-year research study focusing on neuropsychological measures and sports concussion in professional sports. Wow, that's interesting. That's such a hot topic these days. Her postdoctoral fellowship in clinical neuropsychology focused on traumatic brain injury and forensic neuropsychology. Concurrently, she founded the Scandic Neuro Corporation, a consulting research company. The company collaborates on research projects with startups and consults in international and domestic clinical trials. Dr. Dobson has authored articles in peer-reviewed medical journals and co-authored books, as well as presented her work at international domestic conferences. She is an editorial board member for the Journal of Veterans Studies. Dr. Dobson has been a speaker on TED Talks, Boca Raton, and her talk, Good Information is the Start of Good Care, address the needs of mental health reform. She is the Special Interest Group Liaison for the International Neuropsychological Society. Wow, and that's just the abbreviated version. Man, incredible credentials and experience. I think one of the only things she wasn't involved in was the moon landing, right, Alex? I use that one every time, and I think it gets worse and worse every time. It was funny. Somebody sent me something from CNN breaking news, and it said, NASA admits that we faked the moon landing. And so I said, there goes my joke that I use when someone has a lot of credentials. So maybe I won't use it. What do you think, Alex? All right, so I want to welcome her now, Dr. Lena Dobson. Welcome to the Faith and Recovery Radio Show.
Thank you very much. It's a pleasure to be a guest.
Thank you so much for coming on. Well, I guess let's start with, tell us, what was it that made you want to get into this type of work and line of work and career? It's such an interesting one, but it's not very, I don't think it's that common, but I get the whole firefighter thing and why people, would want to do that when they're a little kid and they aspire to be a police officer, but, the neuropsychological stuff, I don't know too many of those people. So tell us a little bit how you got started, what motivated you to get into this field.
Sure. So neuropsychology is the study of brain behavior relationship. And as a clinical neuropsychologist, you conduct assessments to establish diagnosis and then recommend treatment. And the patients that you see may have neurological, medical, developmental, psychiatric conditions. And neuropsychological assessment involves psychological, neurological, physiological methods to evaluate patients' cognitive and emotional strengths and weaknesses. And then These findings are then related to normal and abnormal central nervous system functioning. And the information that you gathered in conjunction with information provided by other healthcare providers is used to identify and diagnose neurobehavioral disorders, conduct research, counsel patients and their families, or plan and implement intervention strategies. So I decided to pursue neuropsychology because I was fascinated by the brain and because I love detective work. And neuropsychology is like detective work. Through the information that you gather during the clinical interview and the reason for the referral, and perhaps a medical records review, you determine a battery of tests to assess the patient, and the test results and behavioral observations allow you to make case conceptualization and arrive at a diagnosis. And then from there on, you determine what recommendations would best benefit the patient. And the process is a wonderful intellectual challenge. And you never really know when you start where you're going to end. So it's just a passion.
That's amazing. That's so interesting because, I work with a lot of different clients that we have that are either dealing with mental health disorders or substance abuse or both. And, there's such a wide variety of backgrounds and things that they've gone through and that type of thing. And when you look at mental health disorders and, mental illness, it's sometimes difficult because it's not that you could take an x-ray or take a blood test and you could definitively say, okay, this is what you have, this is what you need to take, and that's it. With this, it's something that, you don't really know for sure. Basically, you're going by what the client is telling you or the patient is telling you in many cases. But what you're talking about here, I mean, this is beyond that because you can get a better idea from the studies that you do and the research and things like that of the brain itself, of what's going on. You have a better understanding, maybe not 100%, but a much better understanding of why someone is behaving the way they are and they're acting out and they're doing certain things just from the brain. Is that kind of what you're talking about as far as dealing with clinicians and dealing with psychiatrists and things like that? You're kind of collaborating on things of what's going on with someone?
Sure. I mean, it depends on in what area of neuropsychology that you work, but for example, concussions that are a hot topic nowadays, our treatment for concussions should always be multidisciplinary, and you work with occupational therapists, or vestibular therapists, or athletic trainers and whatnot to try to treat the concussion. In forensic settings, like plaintiff's work or IMEs, you can't necessarily always take the patient's word for what is going on. Right, and fortunately, because of the intricate workings of a neuropsychological assessment, we don't have to take someone's word for what is going on. We are able to determine what is going on with someone, whether they are of the same opinion or not, so to speak.
Sure. That's so advanced, and it's so good that we have this opportunity and resource available because, again, people, I always looked at it as, the brain's the most complex organ that we have, and if it malfunctions in any way, which if you're dealing with depression or anxiety or, even with concussions and things like that and injuries, there's a stigma and there's this, all this stuff that kind of gets attached to it, and it really never made any sense to me. If it was any other organ in the body, there wouldn't be a stigma. So why is it with the brain? I want to ask you a question here, and I'm going to reference an article that I was reading. It's from the New Republic magazine. This came out in September 2014. And it's interesting because they quote a doctor, he's a pediatrician, Dr. Michael Wolf, specializing in sports medicine at St. Christopher's Hospital in Philadelphia. He's also on the faculty of Drexel University School of Medicine. But he says that he wants to caution anyone against drawing a line from concussion brain damage to violent behavior. So that's Dr. Michael Wolff was quoted with this. But then it also, later in the article, it says one famous study from 1986 looked at 15 death row inmates and found that all of them had experienced traumatic head injury during childhood. And then there's another study in 1996 that looked at 279 Vietnam veterans who suffered penetrating brain injuries and found that those with all had damage to a particular part of the frontal cortex demonstrated more aggression. So even in the same article, it kind of it's not really a contradiction, but it's two points of view. So one guy is saying, this doctor, Michael Wolff, is saying he doesn't want to draw a comparison, and then and you go on in the study, and it references that it does. So I'm just wondering and curious, what is your take on traumatic injuries to the brain as it relates to violence and violent behavior down the road?
Well, so I think there's a lot of factors that play into the answer, and it is not an easy answer because, for example, I'm sure that you are familiar with Aaron Hernandez, for example, who
Yes.
played in the NFL and committed suicide not too long ago, and afterwards, neuropsychologists determined that he had extensive brain damage, which they determined was CTE, chronic traumatic encephalopathy, and they drew a line that basically his aggression and his behavior came from his brain injury. And I think a cause and effect like that is a dangerous conclusion to arrive at, because there are many factors that play into why someone would be aggressive, why someone would have violent behavior. And brain injury, certainly, depending on what type of brain injury, but brain injury certainly can impact your frontal lobes, for example, that inhibit your behavior, can, create more aggressive behavior, so to speak. Mm-hmm. But there's nothing that says that because you have a brain injury, and concussion, most concussions are a milder brain injury at that. There's nothing that says that because you have a concussion, you are going to have violent or aggressive behavior. Most of the people that, for example, are studied on have comorbidity with other aspects. Like, for example, if you're studying 15 inmates, they're probably in jail for a reason. Mm-hmm. And then it becomes a little bit like the chicken and the egg, yeah. Which came first.
Sure.
And I think, can you find individuals with brain injury that are aggressive? Sure, you can. You can also find a lot of individuals with brain injury that are not aggressive.
Right.
It's a little bit, it's been a little bit dramatized in media on a similar level of, for example, the outcry that we have when a school shooting happens, and we automatically attribute it to the mental health condition of the shooter.
Sure. Yes. Well, that's interesting. That really is. There's so, and now, unfortunately, there's so many examples of it out there with violent behavior and threats that were made previously, and mental health conditions that might have been pre-existing before someone committed a violent act. It's very fascinating. We're going to need to take a quick break. We're going to be back in 30 seconds. We're here with Dr. Lena, Dobson, and my name is Anthony Acampora. We'll be back in 30 seconds.
Are you struggling with addiction or mental health disorders? Banyan Treatment Center's Faith and Recovery Program helps people at the depths of their despair, spreading the word that recovery is possible through the power of Christ.
Cry out to him. Where are you, God? Where are you? I don't feel you. Where's your presence? Why are you allowing this to happen? He already knows our thoughts anyway. We might as well just put it out there.
Program Director Anthony Acampora will help you discover how God can turn your mess into your message. Call Banyan Treatment Center for help now. 888-230-3122. Again, that's 888-230-3122.
Welcome back to the Faith and Recovery Radio Show. I'm your host, Anthony Acampora. We're here with Dr. Lena Dobson, and some really interesting information that we've been talking about as far as the brain and brain injuries and how it relates to possible, mental health disorders and things like that. She's from Scandic Neuro Corp. That's her That's her corporation. And let's get back to it now. Let me ask you, Dr. Dobson, tell us a little bit about, a little more detail about the corporation and the studies that you do with your corporation on the brain and how it relates to actually, impacting mental illness and providing more information. Tell us a little bit about that.
Sure. So I started my company in 2015 while I was still in my postdoctoral residency because research has always been really important to me, and I wanted to find a balance between research and clinical work. And Scanning Neuro allows me to pursue interesting research projects, work in consulting and clinical trials, and to continue to evolve as a neuroscientist along with the clinical work. So Scanning Neuro Corp has several ongoing research projects in the area of sensory perception, brain injury, mental health advocacy, and technology as it relates to mental health. In addition, I work as a consultant involved in central monitoring services during phase 2 and 3 of clinical trials. And central monitoring services are services such as radar training or language translations, data monitoring, education, interpreting test results and whatnot. So Scanning Neuro has many different types of research projects, which is really nice because there's a continued way to educate yourself and learn about the many areas in neuropsychology through the research.
Right. Wow, that's great. And if you're just joining us, what we were discussing earlier was, I was referencing an article in the New Republic magazine, and one point of view was, don't make a correlation to violence and brain injuries, and the other one kind of supported it. So I guess it's, it has a lot to do with the person conducting the study and what their views are on any subject, really. But you were saying something interesting right before the break, Dr. Dobson. You were saying about, so it's almost like if you do go to the extreme and say, hey, you have a brain injury, you had a concussion when you played football in high school, okay, now you have a license to basically do whatever. And I'm sure there'll be some people, if that were the case and that was put out there, that would take advantage of that. We see that in treatment sometime. In treatment, we're obviously trying to get to the root causes, the underlying issues. The addiction is almost a byproduct of a lot of other things in almost every case. And when something comes up, oh, your mother was mean to you, and or this happened when you were growing up, and it kind of gives someone an opportunity to hang their hat on their whole life and say, yep, that's it. My mother used to yell at me when I was little. She was very negative, and that's why I'm like this. Not everybody does that, but sometimes, I can see that happening with something like this. I could see people that were just violent and just had a lot of anger in their heart and hurt people. And then later on, they do some study and show that they, fell when they were in 3rd grade or something and they hit their head. I mean, I don't know either way. That's why, you're the expert on this, but I thought that was interesting of what you were saying earlier on that, because it's such a hot topic now with the violence that's out there in this world. It's just, we look at the Parkland shooting last year. Look at all the times, the threats and the things that were out there that, actually could have prevented this. And it just didn't happen. It was just dropped over and over and over again. So I think we need to get better at this from a mental health perspective and also from, an addiction perspective. And obviously we could do better. But these violent shootings every week is just, it's getting, it's unbelievable. So let me ask you this, Dr. Dobson. How is your company focusing on mental health advocacy? How is it having an impact with that area to advocate for mental illness and things like that, or maybe even break some of the stigma, because if you could pinpoint things that are going on in the brain, maybe that's an area that would help with the stigma of mental illness.
Well, I think there's several aspects to that. And for example, as I mentioned in the TED Talk I just held, mental health simply does not have quality information and technology available in the same manner as physical illness. And patients that are diagnosed with mental illness already struggle with stigmatization and are less likely, even outside of their pathology, to pursue care. In addition to that, you have the negative perceptions that cause this social stigmatization that basically stem from general ignorance or poor information. And when I consider all of these aspects, I see great needs in several areas of mental health. And that's how this venture that inspired the TED Talk was born. My company and a strategic partner, Mosaic TLG, joined forces to launch a product in 2019 that is going to change how we currently think and approach mental health care. For example, imagine being able to quickly identify a local mental health provider that you know is competent to treat your specific condition, or to be able to search and read extensive information about your concerns without having to doubt whether it or not is accurate information, or to be connected with someone who has the same concerns as you. These are just a few things that patients and loved ones will be able to do through this product. Now, in regards to you asked about mental health advocacy, I think there's a large emphasis on education in that there's a disconnect, in my opinion, between clinicians and patients. For example, the field of mental health struggle to create definitions, set real boundaries between specialties, and implement consequences, and this causes confusion for the public. For example, you could be trained as a clinical psychologist with barely any testing experience in your doctoral program, and then go into a one-year postdoctoral fellowship with limited neuropsychological testing, and then when you graduate, you could call yourself a clinical neuropsychologist without any consequences from the general profession. Other clinicians may be aware of your incompetency in that area of assessment, but the public is not. And I find this absolutely crazy. So I made it my mission to try to reform mental health care, and the biggest part of that is just the advocacy, to inform people and give them access to the information.
Right. That's great. It's great what you're doing. It's kind of almost outside the box type of thing. There has to be anything that is moving in the direction to make a difference with the mental health, industry is a good thing, because especially in Florida. Florida and Texas are always the lowest federally funded states. It's like back and forth. I'm not sure which one is lowest now, but there really we're kind of paying the price for not addressing this for years and years, that it's just kind of been swept under the rug, and society pays the price ultimately with people that probably could have been productive members of society if they had the right treatment and things were identified early, but it just kind of doesn't happen, and they end up getting worse and worse, and then we have tragedies. So I think it's great what you're doing. I want to give you some time here to tell people how to connect with you, follow you, whatever you want to put out there, so more people could learn about this and research what you're doing and get involved and connect. So yeah, tell us about how to connect with you and a little bit more, if you want to share anything else about your company.
Sure. One can always go to my website, which is scanicneuro.com. There's also a possibility to follow me on social media. I'm on Twitter, Dr. Lena Dobson, as well as my company Facebook page, Instagram. All of the links are available on my website. If there are any thoughts or comments, one can reach me via email, dobson@scanicneuro.com, or simply call my company, which is 1-888-SCANDIC.
Great. I know we spoke offline about a couple of things, like working on some things. If there's anything that we could do as far as from the Banyan, treatment center, or any type of collaboration or anything that we could do to help, we would love to do that. And whether it just be connections and things like that, and because it's, like I said, it's so important. I just came from the walk, the NAMI walk on Saturday, and my dog got first prize. He ended up winning the dog contest. Luke the dog, it was a big thing. This was his third time in it, but there's such a sense of unity there. And it was just, I used to be on the board with NAMI in Broward, and it was just unity and peace and like love in the air, and everybody was getting along, and it was so much money was raised, well over $100,000 for with NAMI for that walk. And that's what it's all about, just everybody kind of being on the same page, and it was awesome. So this is also part of that, because you're doing the right thing here. So thank you so much, Dr. Lena Dobson, for coming on the Faith and Recovery radio show. We really appreciate it. We're going to need to close. I wish we had more time. If you or someone you know is in need of substance abuse treatment or dealing with mental health disorders, feel free to contact us at 888-270-5712, 888-270-5712, or you could look us up on faithandrecovery.com. That's faithandrecovery.com or banyontreatmentcenter.com. Psalm 147:3, he heals the brokenhearted and he binds up their wounds. Dr. Dodson, thank you so much for coming on.
Thank you. Pleasure.
Okay, thank you.